With my mum, when I was 28 at that time, in '97, Mum was really ill for quite a lot of years. She was in and out of hospital with different things going on for her. But we never got told anything. We never got told that she has this condition or that condition. So all the time she was in hospital, it was just like she was waiting to pass away. She was given morphine for about 3 weeks, just always having morphine and not able to talk, not able to communicate. And then she passed away after her birthday. So it was something that I thought, oh, I don't really understand. I don't understand how this can happen. Is this normal? Is this what does happen? Looking back to my mum, it was unfortunate that I didn't have the knowledge I have now to make, you know, the last part of her life better for her. But then I was able with my dad, so I'm really glad that I was able to do that for him. The difference with my dad is that although he could have had better care, but he did have good care. He was living with Alzheimer's for the last 7 years of his life, and he passed away in 2015. But I was able to, with his key worker and his GP, put in an end-of-life care plan. It would have given him choices had he had capacity, but unfortunately, when that had come around, his capacity had gone because he had late stages of Alzheimer's. So then it was about me thinking about what I'd do for him and what he would want. And I know that he wouldn't have wanted to die in hospital, and he would want to be at home, being cared for by the staff that have known him for 7 years and treat him like their own. And he had palliative care, and everybody was really, really caring. But the fact that there was things in place where I'd decided for my dad that I know what he would want and what he wouldn't want. To me, he had a good death. You know, people might say, well, what's a good death? Well, a good death is where you have choices and you do get the care that you need. My grieving process was different to my mum as to my dad. It took a long time for it to kick in, and it wasn't like there was anybody there to support me, to, you know, see if I needed anything. Whereas with my dad, it's been all the way along that everybody was just very, very different and very, very supportive, and always remember him as well, and remember me. I think it's thinking about what you would want as a person for you if you got a terminal condition yourself, and being able to make decisions and telling people what it is that you actually want, not just automatically thinking, well, the doctors know best, they will tell me what I can and can't have. Because often the doctors don't really know best, not with that part of being cared for. I think it's about having control of your life, and that's the good thing about end-of-life care, is that you then take control of what you want for the rest of your life. Whenever I used to go to visit him after work, I'd go to the hospital and he wouldn't have his glasses on, and they'd be on the table beside the bed, but he wouldn't know how to coordinate to get his glasses, to put them on. And when I spoke to one of the staff, I just said, Dad hasn't got his glasses on, and she said, oh, I don't think he wanted them on. I feel that if that's in your record, if it's in a care plan, and every professional at, you know, the levels that they're at can see that, then they would know then that actually that person might not be able to communicate with me, they might not be able to respond. Because if you could imagine, you can't see without your glasses, but you're also in a place that you don't know. You know, the environment is completely different to what you're used to. So it's all quite upsetting for him, really. But as soon as I put his glasses on, he was like really wide-eyed and sort of moved up a bit to sit up a bit straight and smiled. And I think those things are so important. because within the hospital records, some of them can be like this. I think my dad had about 5 of them. But those little things really, really make a difference. Having music that you like as well, and deciding that and saying what you want, and like your favourite slippers and your favourite shirt. So if you can't make those decisions anymore, at least if it's been discussed and it's written down somewhere, then you're able to have that. So there's all those things that you are entitled to have, those things for you right up until the very end. My dad had a care plan, social services were involved, but case management system that social workers have doesn't connect to the hospital. You think if they had that information connected, they'd both be able to see at the levels that they're at what is going on, really, wouldn't they? Whereas all the healthcare system, GP system, social care system, not connecting, it's really, really, I think, causes a lot of delays. It's like, well, why don't these systems connect together? Which I've had that a lot. You know, why is it that you've got different systems, but nobody seems to know what each other's doing? That is what is required, really, is to make it so much easier for everybody, and even with relatives and carers, because they don't have to then repeat things. If you know that everything's in one place, and everybody who needs to see what they need to see can, make life so much easier. I really think it's, yeah, definitely make life so much easier. It was the best thing ever for my dad, and I know he's up there looking down saying that I did good. To see my dad, I knew that he was ready to be with my mum, and for me to do what I did for him, I think he will always, always be glad of that, because he had 18 years without mum. But I wanted to do the best I could for him. It's the best thing I ever did, was to help my dad have the best last months, weeks, days of his life. So, yeah, so it's just, can't say any more than that, really.